Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's look into the gastric secretion and the factors inhibiting. So factors inhibiting, it includes the first is a low pH. So what does a low pH indicate? It means that it is less than 3 and it is in the stomach, and it is less than 3 pH. So this is when the pH of the stomach content is less than 3 and the gastric secretion is inhibited and by negative feedback. So there is negative feedback and it inhibits the further H plus secretion. So inhibits further H plus secretion. Next is the somatostatin. The somatostatin is basically inhibits the gastric H plus. The somatostatin, it increases the inhibits the gastric H plus secretion by direct pathway and an indirect pathway. So there can be direct and indirect pathway. Then comes let's look at the direct pathway. In case of the direct pathway of the somatostatin, it binds to the receptors on the parietal cells, and then they are coupled with the adenyl cyclase AC, and this is via the GI protein. So this is via the GI protein, and next is so it are coupled with the adenyl cyclase via the GI protein, thus inhibiting the adenyl cyclase and the decreasing the CAMP level. So it inhibits the AC, that is the adenyl cyclase, as well as it decreases the CAMP levels. So decrease the CAMP levels. Next is in this pathway, the somatostatin, it antagonizes the stimulatory action of the histamine. So antagonizes the stimulatory action of the histamine on the H plus secretion. So in case of indirect, what is happening? Indirect pathway, the somatostatin, it inhibits the release of the histamine and the gastrin. So Hg is inhibited. And whereas in the direct pathway, what we saw was the somatostatin, it binds to the receptors on the parietal cells, and they are coupled to the adenyl cyclase via the GI protein, and the decreases the CAMP level. So an indirect inhibits the release of histamine and the gastrin, and ultimately it decreases the H plus secretion. So decreases the H plus secretion. Next we move on to the prostaglandins. So in the prostaglandin, it inhibits the gastric H plus secretion by activating the GI protein. So inhibit the gastric H plus secretion. So inhibits the gastric H plus secretion and activates the GI protein. Activate the GI protein, and it inhibits the adenyl cyclase and decreases the CAMP levels. So inhibits the adenyl cyclase and also decreases the CAMP levels. So what happens to the CAMP levels? It decreases. To learn and grow daily like this, please do subscribe.